So welcome. I am Nicole Caillier, founder and CEO of The Quality Brand. And the fact that you're here tells me one of two or three things. That you've either thought about having a healthcare staffing firm, you have an established healthcare staffing firm and you're maybe trying to figure things out, or you just wanted to connect with me, which is cool too, okay? So this is what I want to share straight off the cuff. There are two things that I want you to walk away with. Number one, I want you to know what your niche is, your niche, however you say it, right? The niches is where the riches are, okay? The niches bring riches. So selecting the right niche really makes a difference in your business. I want you to walk away being able to clearly identify your niche. The second thing that I want everyone to walk away with is understand their geography, okay? You have to understand your geography, meaning the location of your agency. That may not be the location that you reside in, okay? So most people that know me, they meet me right here. They meet me at the place where I've already built a healthcare staffing firm. I entered this industry in 2005 at 26 years old. But most people know me from the Quality Staffing brand, which is a national healthcare staffing firm. The company has expanded. We provide supplemental staffing to healthcare organizations throughout the United States. Those who don't know me from the Quality brand know me from Robinson Success, which is my consulting agency. And to date, we've been doing a lot of staffing, consulting, and training. We are the top consulting firm in the world for established and aspiring healthcare staffing agencies. Most people know me from that. Some people know me from that as well. This year alone, we've launched 100 minority and women-owned healthcare staffing firms throughout the United States. Well, we're just about at 100, okay? And so while I love to tell that story, and it's exciting, it really is, there was a journey getting there. And so I think that some of our time should be spent, and it's most appropriate to talk to you about the journey, okay? And I wanna know, can you relate to having a journey? This is what the journey looked like for me. So before I actually got into healthcare staffing, I was a nurse. Even before that, I was a CNA, okay? That only lasted about 2 months, the CNA thing, and then I realized this is not happening. I was a CNA in 1996 or something, or 1996, making $4.25 an hour. I walked into a healthcare facility and was greeted by the most unfriendly nurse that I have ever met. And when I looked at her, I thought my solution was, I'm gonna go back to school to become a nurse because I don't want people to feel like that, right? And so I was really taken aback by the way that she had treated me and addressed me and was treating the patients and all of this. And so my immediate thought was, I'm gonna get more education. And so I went back to school and became a nurse. And so I thought that that would mitigate the issue, right? I wanted to make a difference in the healthcare arena. I wanted to treat people a certain way. Well, after a few years in health, after becoming a nurse and getting a job and having all the accoutrements of success, I had a rewarding career in healthcare. In fact, right before I had started my agency, I had just gotten a promotion at a facility that I was working at, a healthcare group, and I transferred to another facility. The facility brought me in, they promoted me, they recognized me in front of everyone, and then at some point, I realized that there was still something missing, and I didn't know what it was. I went from the CNA to becoming the nurse. I went from clinical nursing to having my own office and kind of, having a little more freedom in terms of being able to control my schedule, but something was still missing, okay? Now, I know everybody else was thinking, Nicole, you are crazy. Like, you have a stable career, you're a single mom, you pick yourself up from welfare, like your life looks good, okay? And from the outside, it was. But on the inside, I had really reached a place where I was like, I am tired of trading dollars for hours. Even though I had this career, I was also working agency, contract work, right? All nurses have a side hustle. And so I was still spending 16 hours away from 16 hours a day and spending a lot of time away from my son at that time. And I was his primary caregiver. And so one day I decided that I needed to stop trading dollars for hours. And I gave myself permission to do that. For me, this is what it looked like, or this is what I imagined. I imagined going into my supervisor's office, who had just praised me and said, Nicole, anything you want, whatever hours you want to work, we want to work with you. You're generating so much revenue for this facility. I was still a nurse, but I was working on the side of bringing revenue in. Okay, that gives a hint to my skill set. And so they're like, you're doing amazing. Our numbers are going up. You're capturing the revenue, and you're helping with making sure that we get paid and all of this. So I imagine that the supervisor who had praised me and adorned me and was so excited and said, Nicole, anything you want. I don't care what hours you work, we're going to accommodate you. I imagined that when I went in, that they were going to accommodate me. And so I went into the office and said, not that I'm going to quit, but hey, I really want to take you up on that offer. You know, you said that you could accommodate and be flexible. I want to still contribute to the mission here, but I need to spend more time with my son. And so I'm going to have to take you up on that flexibility. So I thought things were okay, right? And they said, okay. And then an hour later, I was approached by the administrator of that facility, who comes into my office when all of my colleagues had went to lunch and commences to fire me. Not only fire me, I was walked out of the building, right? And I can remember what that felt like, hitting those double doors and thinking, wait a minute, this is the same facility that just stood up and said that I was the #1, you know, that they came and got me from another facility. They gave me that catalog, right? That makes you feel really important. Like, Nicole, order all your furniture for your office. Like, money is not an issue. And here it is, I'm getting fired. And so I wasn't laughing then, right? I immediately was thinking, what in the world am I going to do? And I could hear the voices of well-intentioned people in my life saying, you have a kid, you've got to be crazy, you know? And so all of a sudden, my dream seemed like everything just seemed like it was haywire. And so I remember getting in my car and I was crying because there was such a shock that went with that, right? And so it didn't go the way that I expected it to go. And I remember crying. But as I drove away from that facility, I remember that I knew that I knew that I knew that I knew that I had still done the right thing. Even though I was humiliated, even though it was overwhelming, even though it didn't go according to plan, I still realized that, Nicole, you can never put yourself in a position again that someone else is in control of your time, your freedom, and your income. One of the things that had always been intriguing to me was the staffing industry. I watched nurses come in and out of our building on a daily basis. I was a contract nurse myself for many years, and I remember having a conversation with my previous agency. And I remember sharing with them one day some of my concerns as a nurse. And I remember that the owner telling me, oh, I have no idea what you're saying. I'm not a nurse. And the light bulb went off. Why am I letting everyone profit off of my career? Why are other people leveraging what I've invested into this profession? And so I knew then that I was going to start a healthcare staffing firm. And so I want to ask you, can you relate to that? Like, what is your greatest desire with starting your healthcare staffing firm? Is it time? Is it income? Is it freedom? And so once I began actually the process, right, of starting the agency, I was having doors slammed in my face left and right. I was having people come and tell me that there's no way you're going to do this. Like, you're 26. Have you looked in the mirror? You know, you're a kid, you're a woman, you're a Black woman. And so while they weren't directly saying that, they were saying that in not so many words. And even some of my circumstances were reminding me that you're a nurse, you're not an entrepreneur. And so I share that because there's a lot of information on the market, and I share that because I want to convey my passion for why I began mentoring highly motivated individuals, particularly nurses, has a lot to do with what I endured in building my staffing firm. And so while, yes, you know, the revenue has been wonderful. We've made millions of dollars. I've employed thousands of people. Our business operates on a national level. We've done extremely well. My greatest desire and passion is teaching other people how to do exactly what we did without having to go through some of the hurdles that we had to jump, okay, and cross. Because there was a transition moving from nursing to entrepreneurship. And so that is the journey in getting here, right? People telling me you're going to need $200,000. This is not going to work. People are not going to support you. Like all of those things, right? I want you to understand the journey getting here. And so tonight, what I want to tell you is two things that I realized, okay? I'm always evaluating and breaking down things to try to simplify them for others. Two of the things that were very critical to our success are the things we're going to discuss tonight. And those things were niche and also understanding exactly where our geography was, okay? And geography is not necessarily where you are. And so that's how I want to spend our time. I want to talk about your specific niches, and I also want to talk about geography. I don't just like to talk from the apex of our success. I like to talk about the journey because it's in the journey that you can see yourself, okay? I remember what it was like when I was getting into this going, who can I talk to? Who's done this before that's willing to share information? I didn't have $30,000 to get a franchise. And frankly, I didn't have $1,000. Like, I'll just be honest with you. I didn't have a husband at that time. I didn't have a 401 savings plan. All I had was my dreams and my hopes, right? And my desires, okay? So let's talk about niche. One of the things that I realized that made us really successful when I opened the doors in October of 2005 was identifying specifically what my niche was. If you have ever worked with me in any capacity, you know that I am really strong on identifying one particular niche, okay? Now, when I say nursing, that is all encompassing, meaning RNs, LPNs, and CNAs. But a lot of people think that those are the only niches that exist within the healthcare staffing arena, and they aren't. I have mentees that are doing agencies that are CNA only. I have mentees that are doing agencies for PAs. I have mentees. I've worked with people through every aspect of this, but my one thing is pick one niche and stick to it. And I'm going to tell you why, okay? When you try to go too broad too fast, it increases your revenue expenditure, meaning you're going to have more expenses, okay? And one of the things that we don't want on the front end is unnecessary expenses, okay? For 14 years, almost 15, it'll be 15 next year, our firm's primary focus has been registered nurses, licensed practical nurses, and CNAs, okay? Now, that's gonna play off of what I'm gonna share with you in a little bit about geography. But some individuals get into this and say, oh, I'm a jack of all trades. I'm doing nursing, I'm doing physician's assistants, I'm doing medical assistants, I'm doing transcriptionists, I'm doing coders, I'm doing all of these things, and really they're doing nothing. Okay, so I want you to focus on mastery in your niche. Now, your niche is not necessarily what you have done. Okay, so I want to repeat that. We're building a business. Your niche does not necessarily have to be what you have done. Your niche should be where the demand is. Okay? So the first thing you have to consider when building a healthcare staffing firm, you need to know what your niche is. When I walked away from that job, well, when they escorted me out, I knew that it was nursing. I knew that was the aspect and that was the lane. But that was an educated decision because I knew the need in my market. I had a lady call me a couple of, I guess it's been a year or so ago, and I tell this story all the time, not to shame her, but just to bring insight. She called me and she said, Nicole, my market is horrible. There's no work here. I've been doing staffing. I don't know what to do. I'm going to get out of this market. And she's going on and on and on. And I slowed her down and I said, can you tell me where you are? And she identified exactly where her agency was. And I told her, I said, I've made $1 million in proximity of where you are, and I've never been there. And so there's a lot of excuses that people tell themselves as to why their agency isn't working or why the market is oversaturated. I love that, and that's simply not true. You have to have and create an educated, strategic, and systematic plan to get into this market. Know your niche. How do you identify your niche? Study, okay? You want to go to online platforms, online job boards. You want to go to some of your local papers. People think it's a little antiquated with the newspapers. It's not. And so I want to make sure that you know exactly where the need is. Okay, so this is case in point. If I was going to, let's say, open another agency in Indiana, I would start surveying where the greatest needs are in Indiana before I open my doors. I would not just go into the market and say, well, I do RNs, LPNs, and CNAs. That's what I'm going to bring to the market. I would study what the greatest need is in that market, and that's what I would position myself. Or if I was dead set on RNs, LPNs, and CNAs, then I would move into that geography where that need existed, okay? So you need to study printed materials, study newspapers, study the online platforms. I teach this a lot when I'm working with someone behind the scenes, where you need to go to look and see what positions are available and open. You need to know the quantity of full-time and part-time positions open in a particular geography for your discipline, okay? That is going to indicate if there is enough business for you in the area. Okay, one of the prime spots, and I'll just kind of throw this out. Well, I won't specify the city because I'm working on the project with someone, but it's in New York. And when we broke down the numbers, I'm going, oh my God, if there was only 1% of the market share, this firm could do over $1 million in one little city, just simply because the needs are that great. Okay, now there's a formula that goes into that, but their primary need was registered nurses. So obviously that's what we need to cater to in that market. Now, if we move into, let's say, Michigan, their primary need in some areas is for nursing assistants. And so it's strategic that you would go there and give them the solution that they need. You should be able to stay in one area. If you do strategically position your firm, you should be able to stay in an area for at least a year, okay, before expanding. There is enough business, I kid you not, in every city and state if you know what you are doing. And so there would be enough business within a 60-mile radius. And I say that because you're going to start expending too much revenue. And again, going too broad, being a jack of all trades and a master of none. We made our first $1 million with 4 contracts. 4, that's it. Now, we have tons of contracts. But to hit the 7-figure mark, we use 4 contracts. That's it. So it's not volume here. It's getting into a facility, establishing a relationship, doing a really good job, supporting that facility's needs, and growing your business in that geography. Okay, so you don't need to go so broad, right? You need to go deep. You need to go in depth. Okay, so that's the niche. One of the things that I see all the time, people come to me, I swear, I love Iyanna Fix My Life, but I feel like starting a show that says, Nicole, fix my agency. People come to me all the time and say, Nicole, I don't know what to do. And it's amazing because what they've done is jumped into the market on their own, not knowing what they were doing, kind of just started and running with it, right? And I kind of get it, but then I really don't, because in the long run, it ends up costing them more, because you cannot build on a foundation that is not solid. And so the beginning stages are research, okay? You need to have research versus having to later get somebody help you tear it down and rebuild it, okay? So we need to make sure that you know specifically your niche, okay? Certain niches are going to generate more revenue. Yesterday, I did a formula and I got excited myself because one of my private clients is going to be able to staff 10 individuals in one discipline, okay? Just 10. Now, this is a highly specialized area. So when you get into like ER, ICU, some of the dialysis positions, physician's assistants, and so on and so forth, some of those specialized areas, the profit margin is extremely higher. And so this particular client is in a really top tier, very niche and very specialized area. She can literally place 10 professionals. If they work consistently 40 hours a week, I'll give you her numbers, okay? 40 hours a week, her profit margin started at $35 an hour. So we came up with 10 people working, and then she was going to do 40 hours a week, each one of them. And then obviously there's 4 weeks in a month. Okay, so here's the numbers, okay? This is how we did 7 figures with 4 contracts. She only has 10 people working 40 hours a week, which is 400 total hours, $1,600 a month, and her return potentially could be $35 an hour, minimum. This number is gonna blow your mind. $56,000 profit a month, okay? Times 12. And that was the minimum, times 12, $672,000. That's only 10 people, okay? The market that she's in is untapped, okay? If you get into things like infusion staffing, there are so many areas in here, and the higher your niche, it's just like the hospital, okay? The more advanced the doctor is, the more specialized, the more money they're gonna generate, the more revenue, okay? And so staffing is no different. Now, here's what I'm gonna share with you about the correlation between your niche and your geography. So let me show you the correlation, okay? While we didn't go specialize with our agency in terms of the discipline, we went specialized in terms of geography. And so most people say, well, Nicole, how do you get those huge returns with the facilities that you provide staff to? So our specialty initially was rural facilities, okay? So we were doing smaller facilities, with lower quantity in terms of beds, but a lot of those facilities are overlooked because the larger firms simply think that all the money is in the 10-story hospitals, and that's not true. We made $250,000 at a 40-bed facility in Pennsylvania that no one knows about, okay? And so don't underestimate location. So the second thing you want to do is understand the geography. So in 2007, after having started my firm, it was successful. We had made $500,000. I lost everything. If you've heard me say this before, just kind of bear with me, okay? I love to share from not only the places of the mountain, but the places of the valley. Here is what I learned and why I teach location, okay? I teach location because after we lost everything, all of our business had been localized to our local geography. And we were fighting and fighting and fighting to make a change over this 9-month period when our business pretty much tanked. And the only ideal I had was that I just needed to rebuild locally. Well, thankfully, and I think very divinely, we got an ideal to kind of strategically position ourselves to expand in other areas. Now, this was in 2007, so things weren't like they are now with technology. I mean, I had a fax machine. I don't even think we were emailing, okay? I had a fax machine. I didn't have a computer. We may have had a desk calendar. I mean, it was really old school kind of bootstrap staffing that we were doing, but we were still making money, okay? We were still doing well and making a great difference in the healthcare community. But when that happened in 2007, it forced me to think outside of my location, okay? It wasn't common back then. It's more common now. And so this is why I say all the time I get emails and messages, or my team will tell me, well, this person wants to talk about their geography. And so if you're one of those people who I have not got on the phone with, I'll tell you the reason why. Because I'm never going to tell you to build exactly where you are unless it makes sense. So if it makes sense and you're in a viable market, then that's wonderful. But if you aren't, I'm not really concerned about your market because I know that we will go to where the market is. And we just build your business around where the needs are, okay? And so I want you to understand that our success was not only in the niche, our success also came because we clearly identified locations that had the needs, right? And that we could fill. Now, there's a whole system that goes into that. It's really simple, right? It's not anything hard, but you have to clearly understand, have some of these key factors in place to be able to plug everything in. So a lot of people get stomped. I've seen a lot of staffing agencies close needlessly. And it's simply because they're so focused on the local geography, right? There's a part of all of us, I think, that think, well, it's just going to be better here because I live here. And that's not necessarily true. And frankly, I'll be honest with you. There are some facilities that I still have not visited. And we're doing business with them and have been, okay? And so this is why I love the staffing industry. I tell everyone it's been a bank for all of our other businesses. I've never had a loan or a grant in 14 years. I figured out how to do this successfully, how to scale, when to scale, and how to have a solid infrastructure. I cannot stress that enough. I see businesses go out each and every day, healthcare staffing firms that could otherwise survive if they had the right information. And I know that a lot of it has to do with the infrastructure. They get in the market, they built it, and they think people are just gonna come, and that's simply not true. You have to build where people are, and you have to meet the demands of the market. So you can't show up in the marketplace and present the solution that you wanna present. You have to show up as a solution to the problem that exists, okay? So make sure that when you're building your firm, you are aware and you're very intentional about your niche and also the location. Location matters. Your niche matters as well. So again, our specialty was rural, so our profit margins were a lot higher. In my local market, my profit margin back in 2007 may have been $8 per hour, okay? Meaning if I had 1,000 hours for a week, then I was gonna get an $8 return after everything had been paid for employees and that type of thing. So $8,000 a week. That's not bad, okay? $32,000 a month. That's not bad. But here's what happened when I expanded to other geographies that had, and we were more specialized and focusing on the rural facilities. All of a sudden, we could increase our pricing. We could increase our our exhibit and our rate proposals. And so we went from fighting to make $8,000 a week in our local market to very graciously making about $16,000 because we doubled our profit margin. So where we were making the 8, we were now making 16. It took less work and we had more results. And as a result, our clients were happier. So we went from doing $32,000 in our local market with a ton of facilities to going into more specialized facilities and doing about $16,000 a week on average, or $64,000 a month, okay? That's huge, that's huge. I was talking with one of my, I say he's one of my mentors. He's been in this industry for so long. And he actually has made, I think, several $100 million in the staffing industry itself. And I remember one of my mentees was telling me she had made $10,000 and she was excited. And I told him, he said, well, how is it going with your mentees, Nicole? And I said, well, it's okay. I said, so-and-so just launched it. She made 10 grand this week. And I said, well, you know, she's doing okay. So he said, okay, what do you mean okay? And so it was funny to be having that conversation because what he told me, and again, he's $100 million, right? He said, well, you just said it like it didn't even matter. So I told him, I said, you know, that is nothing in healthcare staffing. You know that. But he reminded me, he said, Nicole, but this is her first $10,000. Like, who's making 10 grand a week, you know? So I had to humble myself, right, and celebrate that with her. But it was still a great conversation to have because both of us are aware of this, the viability of this industry if done correctly. There's a huge demand for healthcare staffing firms. And a lot of people think, I just did a podcast for nursepreneurs. In fact, I think it came out tonight. And one of the questions she asked me is, Nicole, is the market oversaturated? And I said, it is if you think it is, but every day there's students launching, they're getting contracts, they're developing relationships with clients, they're generating revenue, but more importantly, they're taking back their time, their income, and their freedom. And all at the same time, they're gaining authentic ownership in the industry that we serve, right? So I just want you to think about that. What is your greatest need at this point today to get your healthcare staffing open? Now, I want to do a formula quickly. I won't keep you long, but you have to make the numbers real. Let's break this down because I want you to see how possible this is. For those of you who have your numbers, I can't do everyone's number, but just follow what I'm doing and then break your number down. It doesn't make sense until you can eat the elephant one bite at a time, okay? And so you really need to know how you're going to get to the 500K. I'm going to assume that your profit margin would be somewhere around $16 an hour. There's a wide variety of reasons that I'm assuming that, but let's start there, okay? So that means that at a profit margin of $16,000 and $16 profit, meaning every time you make a placement, you're going to get $16 above. Really, you're going to get $18, but we're going to reduce $2 for your burden, but we'll talk about that later, okay? But the $16 is your profit. So that means that you have to have 31,250 nursing hours for this year in a 12-month period, okay? Now, 31,250, we're going to divide that by 12. Boom, that gives us 2,604 hours. I love this formula because it's easy. 2,604 hours for the month, okay? And now you need 651 hours for the week. And there's 7 days in a week. So you need 93 hours a day. And I'm going to assume that you do 12-hour shifts. That means that you would have to have 7 people working per day, 7 healthcare professionals, 7 nurses, 7 medical assistants, 7 LPNs, 7 CNAs, 7 RNs at minimum working per day, okay? You can literally get that in one facility. Although I would not suggest having one facility, my recommendation would be you need at least 3 contracts, but this is not a number that is unmanageable. Most of our facilities call for, some of them actually, those of you in staffing or who've been around it, you know that facilities are calling for 8, 9, 10, 11 professionals, sometimes per shift per day. And so this is attainable. The reason that I want you to break down your numbers is so that your numbers will drive the action that you need to take. So when someone comes to me and says, Nicole, I want to make $5 million, I automatically know I have this formula, but now that person is going to have a completely different daily plan of action than someone who wants the 500K. So this number should drive everything that you do on a daily basis in your agency. It's going to drive the infrastructure, the setup, the action, your marketing, and everything to get to this number, okay? So you don't just make, people are funny, right? People will come and ask me all the time, oh, Nicole, I just want to make $1 million. You don't just make millions of dollars. You have to plan for it, okay? I have planned for this at every stage. And I want you to do that too. You have to plan for it. So use that formula consistently. Even now, 15 years in the game, when I put my numbers up, they're in our conference room. Our numbers, we have that outline. I make my team look at it because the numbers are big and they get bigger and bigger and bigger. But we eat the elephant one bite at a time, okay? I was challenged to increase our revenue by another 7 figures this year, and so this upcoming year. And so I'm doing the same formula that I'm giving you guys, okay? But I know what action needs to happen with that so that we can accomplish that and we can make it real, okay? And so I just want to kind of say this in closing. The 2 things I hope you know right now are your niche. If you don't, that's where you need to start. You need to start with your research. The next thing is your location. It does not have to be, take the limits off. Your agency does not have to be in your backyard. It doesn't, okay? It does not have to be in your backyard. And so I just want to say this to you. If you've been considering healthcare staffing, then I invite you to reach out to our team. Now, I do want to say this, and I want to be honest. I take what I do very seriously, and I love it. I love it. I love seeing people change their lives. I have one of our students who is amazing. She's actually one of my favorite mentees. She hit the 6-figure mark. She reached out to me today. She has another contract. She's the founder and CEO of NrC&x Staffing. I love getting messages from her. she asked me, she signed up for the course back in February of this year. And then the next day, she said, I want a refund. I can't do this. I don't know what I was thinking. I got a full-time job. And I'm thinking, oh my God. And I just slept on it, right? And she slept on it. And she called me the next day and she said, Nicole, I apologize. I'm going to do this. And so I remember working with her and going through everything with her and the transition that was happening, because she was working full time while she was doing this. And so she would always say, can I do this? Do you think I could do this during our sessions? And I'd say, well, you're doing it. Like at this point, you're doing it. And so it's such a great feeling. She completed the program back in May, but to hear her say, not only is she making 6 figures, but she's opened her office. She has internal staff. She has external staff. She's making a difference in the healthcare, and it hasn't even been 6 months. So I live for that. And so I was kind of working out a client avatar, because I said, I want all my clients to be like her, right? And so because there is a model for success that's beyond just a formula, there's an internal model also. And so one of the things that our most successful mentees have in common, and that's just one story of many, but our most successful mentees are action takers. You know, they are really dead set on doing it. They aren't afraid of what's coming, you know, the challenges. They're positive. They want to do it in a community, right? They want to accelerate their results and partner with information. They don't want to be out there alone, okay? Information is your greatest commodity. In 2007, when we lost everything, I had to go get new information, and I had to face the reality. Nicole, you started this and you were a nurse. You were not a business owner. You were not an entrepreneur. And I remember at that time I got married, and I remember crying one day because my husband said, you are still thinking like a nurse. And he didn't care about the tears, and he didn't say it very nice. But I am so grateful at this stage of my life that someone stepped in and said, girl, you need to step your game up and go get information to do what you said you want to do. And so I'm inviting you to that opportunity now. If you're one of the ones, if you're sitting back saying, Nicole, I'm tired of wanting to do this, I'm ready to go from wanting to do this to actually doing it. If you're saying, I'm tired of trading dollars for hours, like I want my next, and I know it doesn't involve me wearing scrubs, I want to do it with wisdom and guidance. Like I can totally be that lady from that amazing mentee from NrC&x Staffing or Focal Point Staffing or some of the other staffing firms that you'll see the testimonials on our site. Then I want you to reach out, okay? I'm wrapping this, so I'm looking for people who are ready now. And if this was just informational for you and it was great information, that's fine. But the people that we want to work with are ready to do this, not making excuses, and really want to get out there and are not afraid to invest and make money. Okay, the healthcare staffing industry is a $1 billion industry. There is no reason that all I am is you on fast forward. And that's what I love about my story, because I was a nurse, I was a single mother. I just decided one day, like, this is not, I'm not going to keep doing that. And then life made me have to do what I had been thinking about. Okay. But again, I don't think my story is, you guys hear about it and you see it and everyone's like, oh my God, it's amazing. I'm just you on fast forward. That's it. All I did, the only difference is I decided and I kept taking consistent action. And so listen, thank you for joining me. I have loved sharing this time and I thank you for letting me share my heart with you. I love healthcare staffing, but even more than that, I love helping women to actually be successful in this industry and not have to make the mistakes that I made and the challenges that I made, okay? But again, thank you for your time. Have a wonderful, wonderful evening and be blessed.